Everybody. Thank you so much for coming here today. My name is Kevin Grundy. I'm a member of New Zealand Association of Medical Herbalists, a member of the American Herbalist Guild. I specialise in Western herbal medicine, nutritional and natural health. I'm a 3-star Youngevity executive. I'm also an independent distributor. It means that I don't work for corporate directly, but I work for myself. The respiratory system. So the respiratory system, so the top respiratory illnesses we see within the respiratory system is things like asthma, COPD, your colds and flu, your bronchitis, emphysema, your lung problems, cystic fibrosis, pneumonia, and pleurisy. So these are common lung disorders, and we see these disorders manifest from various different reasons. And today we'll go through just a few of them. And so the reason I'm talking about the respiratory system today is because throughout this whole lockdown with the virus, etc., all the problems we're having, it's all focusing around the respiratory, because that's the part of the body that is giving us problems through this whole period. So I thought, well, I'll do a talk on the respiratory system, not per se the coronavirus, because that's just one little bug within the whole living community which we deal with every day. And so I thought, well, let's do a good talk on the respiratory system. So asthma, what is asthma? So asthma, your airways narrow and swell, which makes them harder to breathe and makes it, you cough up mucus and other stuff. It's like you're purging. So asthma is when your lungs go really tight and it feels like somebody's sitting on you. It can be an allergic response to things like pollen, dust, or smoke. But exercise, cold air, and common colds, and even stress can trigger it. So just other things, if you're walking around in the park and all of a sudden you go past a tree and you start having asthma, or it could be the pollen effect from that particular tree. So if you talk to your health advisor, they can help you work out what your trigger is as far as asthma. And certainly I have seen with many of our asthma patients that respiratory problems, things like excessive mucus buildup, foods like your dairy and your gluten, they create inflammation responses. So they trigger things like asthma. Then you got your COPD, chronic obstructive pulmonary disease. So this is a group of diseases like emphysema, chronic bronchitis, asthma. So this is like when you have a lot of these problems and they group them all together. The medical system has this really cool thing about they group a lot of our health challenges together. So COPD, it's very common terminology used when people have lots of sort of lung and respiratory issues. So it's an irritation of the little villi, the little sacs inside your lungs. And so what happens is that those sacs, they're normally like, if you imagine like little balls of marble, but inside them they're hollow, they're full of air, and they're under tension. And it's that tension that keeps them working effectively. And what happens when we start to get some inflammation in our lungs, these little villi, these little balls, start to lose their tension and they'll start to fill up with fluid. And of course, the more fluid that fills these up, the less contact the tissue has with the air, the oxygen, and we can't get the oxygen transfer happening. Okay, so again, your health advisor will help you with what medication. It could be a herbal medication just to help you get through this. Okay, and of course, the most common problem we see with these types of issues is somebody who is a smoker, or when you're in an area where there's lots of high air pollution. Colds is probably going to be the most common thing we're going to see, especially throughout the winter season. Cold is a virus. You get viruses that causes cold from people who sneeze. So it brings on runny noses. All the symptoms you get with a cold, that fever, the symptoms we see with all types of viruses. It may irritate your lungs, in the airways and give you a bit of a cough, tightening, asthma. Again, just giving you all those symptoms again. There's no cure, so expect the sniffles and sneezes to last about 7 to 10 days. And I certainly know if you've got a strong immune system, you could be on the lesser side of that. I certainly know when, because we're around sick people all the time, when we start to feel our glands getting up, a bit of temperature starting to happen, then we reach for our herbal medicines and we can knock it off in a few days. But certainly if you leave it on its own, then its natural course is 7 to 10 days. But remember, during that time, you're also infecting people. Bronchitis, this is where your the bronchial tubes in your lungs, they start to get inflamed. So the bronchioles, the tubes that carry just the fine air in and out of your lungs, they get inflamed. And when they're inflamed, you can't produce, or you can't transfer or exhale and inhale as much air as you like, and it's always feeling tight. A cold or a flu or an irritant like pollen can cause these problems. You may cough up a thick mucus or coloured mucus. And so as the coloured mucus changes, as it gets the deeper green, that thick green, yellowy green, as I said, that's the pus, that's the infection coming out, that's the body purging it, and that's what we're trying to deal with. So we're trying to deal with that infection by utilising, good medicines, good food. Pneumonia, this is like the end of when you have respiratory problems. Many people will die of pneumonia. It is when the villi, there's a bacteria in your lungs, and when the bacteria starts to get out of control, it damages those villi. That's those little balls, those sacs I was talking about, and they just fill up with air. So virus, bacteria, fungus infects the air sacs in your lungs, which fill up with fluid or pus. You may have a temperature, find it hard to breathe, and a cough, and you cough up that thick mucus. It can be serious, so see your doctor if you have problems. Many people, especially the elderly, the 20 people who have died from the coronavirus here in New Zealand, most of them have died from some form of pneumonia or lung infection. Lung cancer is another respiratory problem we have. This is too common, especially with the smoking community. Faulty cells grow into tumours in your lungs. As I said, smoking is one of the biggest problems. You may not notice the early signs on that early stages because these things grow inside, but you might end up with a bit of pain later off. You might end up with a cough that won't go away. Morning cough is another good one. If you get in the morning, you get that morning cough and it doesn't go away. You might need to go and see a health practitioner to find out a little bit more about it. But early screening of lung cancer, these things can be addressed and turned around. It's only when we start to leave these problems that they manifest into something that it's harder to deal with. Pleurisy. So pleurisy is the tissue or the lining in your lungs. They separate and they start to rub together, and that rubbing together creates a lot of inflammation and a lot of pain in your chest. It causes a sharp pain that gets worse when you breathe in, breathe out. Of course, when you get a cough, you could end up being a bit short of breath. A virus, bacteria, or fungus can cause these sorts of problems, and certain drugs can also create pleurisy. Most people should fully recover, and your treatment depends on what caused it. So whether it was a bacterial infection or whatever caused the pleurisy. So the coronavirus. What happens when you get a virus? Now, I'm not talking about the COVID-19. I'm talking any virus here. Because if you've been watching the stats, you'll understand that this COVID-19 is actually just worked out to be a very hard winter flu virus. So if you've been watching the stats around the world, the countries that haven't done much with it, you'll see the stats have gone exactly the same way as if we would have had just a really bad case of the flu this year. But what are we going to do? We've got to stop it from spreading. So it doesn't matter what viruses running out there. We don't want it spread. Nobody likes having the flu. Nobody likes having these headaches and runny noses and feeling this bad temperature. So we should always take these precautions anyway. Always wash your hands. We know that the touching of stuff can spread it. We know that droplets can spread it, and we know that touching of your face after you've touched something can also spread it. So there are many types of the coronavirus, and of course we know the common cold one, and of course we now know the COVID-19. So how does it attack the body? The virus can affect your body by entering healthy cells. So these are cells that are doing the normal thing in the course of the day, and then of course they get attacked by this big beast. There's an invader that makes a copy of itself, and it just keeps producing itself, just like cells work. They double, they double, they double. The new coronavirus latches its spikes. So as you can see the picture to the right there, they got these spikes. So these spikes latch to a protein receptor on the healthy cell and start to cling and do their job. Specifically, a viral protein bursts into the cell through the ACE2 receptor inside the cell, and the coronavirus hijacks the cell and takes command. It's a bit like one of these big ships out in sea in the Persian Gulf, and these pirates, and they go through and they take control of a massive ship. Okay, so this virus just takes control, takes command, and starts eventually killing off healthy cells before our own army comes in. So it moves through your body. So the illness caused by the virus starts with a droplet from an infected person. This could be a cough, it could be a sneeze, it could be a breath, it could be something that they've touched. So it could be in the air for up to 6 to 12 hours. That is correct. So it's not about the cough. It's about being in the environment where somebody breathed out heavily. They could have run in from outside and ran into the shop, and that hard breath throws it into the air, and it can stay in the air for 12 hours. Well, that's scary. Or it can stay on surfaces, especially the film bags, like your shopping bags or your bread bags. It can stay on that film for 3 to 4 days. And so you can see why we need to clean our hands regularly before we touch things, because it's so easy to move around from place to place, being unaware of what we're doing, and then putting, just touching your lip or something, easy to transfer it. So within 2 to 14 days, your immune system may respond with some sort of symptoms, including, and we know them all, fever, cough, shortness of breath, fatigue, chills, loss of taste and smell, body aches, headaches, sore throat, nausea, and diarrhea, And it could be one of these things. It could be all of these things. It could just be a slight temperature with a slight sort of in the back of your throat. It affects people in different ways depending on how strong your immune system is. So this particular virus drives down deeper into the lungs, deeper into where those sacs are, those villi sacs. Okay, and so it passes through your nose and your mouth all the way down to your lungs. The lower airways have more of that ACE2 receptor we talked about earlier, and so this particular virus goes looking for that particular protein, which is more deeper in the lungs than the other viruses would be, say like your common cold. So your lungs will become inflamed, making it harder for you to breathe. This can lead to pneumonia and an infection of the tiny little air sacs called alveoli inside the lungs. So you can see these pictures on the right-hand side there. The top picture shows what the villi are. They're like little balls, and on the outside of the balls are lots and lots of little blood vessels, capillaries. And they're taking the oxygen, which is coming from the inside of the ball, which is where our air is, and so it goes through the ball into the blood and then into our body. And so with that bottom picture, you can see that little ball as the villi. Normally that would just be air, and it's under pressure, under tension, and so water doesn't get in or form. But when we get inflammation, when we get the breakdown in the tissue, then fluid forms, and of course we can no longer hold air in there, and with no air, no oxygen, and we don't get this oxygen exchange. We can also get another condition called ARDS, ARDS, and that's to do with rapid breathing, a fast heart rate, dizziness and swelling. It damages the tissue and blood vessels in your villi, again, causing debris to collect inside them. This makes it harder or impossible for you to breathe. Again, these are conditions all to do with the respiratory system. Many people who get ARDS need help from a machine called a ventilator. Yes, you've heard that word being thrown around quite a bit recently. All these countries getting lots and lots of ventilators, but they didn't need them. So that's a picture of a ventilator to the right there, and it just helps the person breathe. So when their muscles and their lung muscles are really, really, really sore and they can't breathe for themselves, normally the patient would give up, and that's when they'll die. These machines help keep those lungs going, the air flowing, and so until their body can recover. As fluid collects in your lungs, they carry less oxygen to your blood. That means that your blood may not supply your oxygen organs with enough oxygen to survive, and this can cause your kidneys to stop, your lungs and liver to shut down, and everything to stop working. So the importance of keeping our lungs working properly. What else does it do to your body? Well, some people have also had symptoms of pink eye. It's when you get like all the redness in your eye, rash, liver problems or damage, kidney problems, liver, blood clots even. So there are other things that can go wrong when you get a virus, and it doesn't need to be the COVID-19, just any common coronavirus. So where do we go with all this? Well, you know the answer. Let thy food be thy medicine. Our food is our medicine. We're designed to process foods to take out the nutrients from the food and use those throughout our body as energy foods. And so we need to strengthen the immune system with a good, proper diet. The diet needs to be higher in protein and lower in sugar. Your immune system is made from protein. Everything we eat tends to convert to protein, which I say most things we eat converts to protein. But here's the catch. When we have too much sugar, especially too much processed sugar, because of its high sugar content, it stops things working. It stops the dormant or your immune system from understanding what's going on. It puts your immune system to sleep. And so when you've got these bugs and viruses running around the place, if you're high on sugar, I say high on sugar, then your immune system's not going to respond in the time frame required, and of course you then become sick. Cut back on sugars. So let food be thy medicine. We know that vitamins are very good for the body and how it works. Researchers have identified quite a few, respiratory, again, spelled it wrong, vitamins. So like vitamin D, for instance, studies have suggested that people who have had low vitamin D have had issues. People with vitamin C have problems with shortness of breath and wheeziness. People with vitamin E deficiencies, studies suggested they experience flare-ups consistently all the time with lung issues than people who don't have it. And also studies long-term use may help prevent these COPD types of conditions. Vitamin A also has helped reduce problems with lung and respiratory issues. In this particular case, one study showed there was a 52% lower risk by taking vitamin A. And of course, we know that you don't just take vitamin A or vitamin E. You need how many? 16 essential nutrients. So where can these come from? I'm a great believer. If we grow properly, we can get a lot of our stuff from our foods. If we put our minerals that we are so proud about, we put them in our garden. And so our apple trees, our fruit trees, they produce beautiful fresh fruit. They can be rich in minerals. So put them in our garden. We have the beautiful blooming minerals, liquid minerals, or you can make your own liquid minerals by buying the granules, soaking it in water for 6 weeks, and make your own liquid minerals, and your plants will love you for it. And so apples are really rich. They're a good form of vitamin C, E, beta carotene. All these are great for helping cell structure. Walnuts are a very good source of fatty acids, and we certainly know, we understand the importance of essential fatty acids. Berries, especially cassia berry, blueberries. Sally loves her blueberries. Blueberries are a wonderful thing. Get some nice organic wild blueberries that are the healthiest. Because remember, when things are sprayed, they put a chemical on it, and that damages our digestion. So we're always constantly looking for organic. Okay, and berries are very high in antioxidants and very high in vitamin C. Broccoli is a great one. If you don't have a sensitivity to broccoli, then broccoli is your friend. High vitamin C, flavonoids, folic acid, etc. Good for your lungs. It's said to help activate a constituent called an L-sulfoxanate, don't know what that one is, which is a particular chemical which it's like a switch, switch that switches on the anti-inflammatory receptors inside your respiratory system. Cayenne pepper, a great one for opening those pathways. It's a vascular dilator, and so help open things. Bear with me for 2 seconds, guys. Okay, back again. Just had to get rid of that muting. Where was I? Yes, cayenne pepper. So cayenne pepper is the hot pepper, and it's really good for helping to open pathways. Good to have around if somebody potentially could be having a heart attack. A bit of cayenne pepper in your bag, in your purse, in your car. If somebody's having a bit of a heart attack, a bit of cayenne pepper helps open those pathways again, gets it all working. Ginger, we all know that ginger is a very good herb. It works in so many areas, especially digestion. It's an anti-inflammatory. It helps detoxification, helps any congestiveness, unclogging of airways. Really good for circulation, which of course means circulation of the lungs. Flaxseed, we know it's essential fatty acid. Very good. We know the importance of essential fatty acids. Garlic, again, we know the power of garlic. It's antimicrobe. But the thing to be an antimicrobe means antiviral, antibacterial, antifungal. So to be an antimicrobe, the garlic has to be taken raw. The minute you cook garlic, you heat it, you destroy the molecules that do the killing inside us. So remember, have your garlic raw. If you wish to disguise garlic, well, then you can have some nice gluten-free toast with some gluten-free cheese, and underneath the gluten-free cheese, dairy-free cheese, I'm talking dairy-free cheese, you crush some garlic under the cheese or something, and so the garlic itself doesn't heat up, but everything else around it does. Another way of taking garlic. So really good. Garlic is underutilized, it grows so easy here. It's good cardio, helps thin the blood, I think we should use more garlic, And turmeric, another one. It's in Australia. It's one of your pet products. You grow it well. It's in a lot of foods now. It helps with tissue growing. So if you've got any damage in your lungs, one of the things we need to do is once we've dealt with the infection, dealt with the inflammation, we need to repair the damage of that tissue. And so we need to encourage good tissue growth, and that's where turmeric comes into it. Turmeric promotes good, healthy tissue growth. So more cleaner the turmeric, the better it's going to work. And the Youngevity turmeric, of course, is an extremely pure turmeric, hence why its name is turmeric. Okay, like all good health practices, it really all starts by cleaning up the diet. If we don't get rid of these bad foods, we're not going to reduce that inflammation in the first place. Wheat, barley, rye, oats, it's got to go. Processed meats, all it does is kill your good bacteria. Get rid of it. That goes with organic foods. Make sure you get rid of sprays. All it does is kill your bacteria. So in order for the body to function optimally, it needs 90 essential nutrients every day. Remember what these are. They're indoctrinated into us. 16 minerals, 16 vitamins, 12 amino acids, and 2 fatty acids. Fatty acids make up our mighty 90. This is our starting block. People on this alone are going to see the benefits on their respiratory system. Why? Because it's building our immune system. A strong immune system means that our body can fight things. Okay, we don't need the killing factors of some of our other products, which we're about to cover. So what do we turn to? When we have this illness, what do we do? It's more than just keeping your immune system strong. You've got a healthy immune system. You come across somebody, they've given you the yogi, what do? Well, you start to reach for some stronger products. Now, for Youngevity, at the moment, we've had a bit of a rush on these products, so why they're air freighting more in when they're not available, but we still need to know what they are and what we're using them for. So the seasonal immune pack, this is a powerful pack. It should be on everybody's pantry or first aid pantry, okay? It's got zinc, immune 911, CFF, that's a CSFX is vitamin C. It's got our famous killer biotic, and it's got, again, more vitamin C. This is one pack that has all of these products in it. So when it comes back in stock, it should be something you always have. When you've run out, you buy another one. It should always be as a first aid cabinet. If your budget doesn't stretch to the immune pack, then of course, Killer Biotic you can buy on its own. Again, it is out of stock, but it will only be for a short while they air freight more in. Okay, now this is a proven product. Anybody who has been using Killer Biotic will now know the power of what it does. Again, you just got to remember, use therapeutic dosing. Therapeutic, if you're a big person, that means you're going to have lots of these products in a very short period of time. So I reach, if I feel my glands coming up, I feel a bit of temperature, I'll reach for my Killer Biotics and I will go 3 to 4 times a day, 5 times a day if necessary. Okay, yes, I can kill off a bottle of Killer Biotics in a week, 10 days, very easily. I'm not going to go through these features. I've talked about Killer Biotics in many of my talks, but it's got the some real powerful products in there, courtesy of our Killer Bees with the Populous and various other products. And again, a respiratory product or formula would not be complete without a good herbal tincture. In this case, the Good Herbs Respiratory Support. The respiratory support contains proprietary blend of organic and wildcrafted herbs that are for your lungs. So it supports the airways, the blood vessels, the muscles, and everything else, the mucous membranes, everything in that respiratory, this product supports. Okay, because when you start to see the ingredients, you see how and why it works. There's that garlic again. Garlic is a great product. Campaign, it's a great product to help kill anything inside. Marshmallow is a great soother. You know, so this is a really good product. But please, the dosing we read on the bottle is for an American dosing system where they play it safe. This is designed for children. The dosing is designed for children. So we use our normal dose of 5 mils 3 times a day for the average weight. 5 mils 3 times a day is what we would use as a medical practitioner, okay? Because we're looking for that therapeutic response, and we just do not get it when you take low doses. So what other things? Well, we have a whole pile of products, and I've talked about these products. These all stand by themselves. They're great products. We've got the colloidal silver. We've got the super olive. We've got the oxybody with its hydroperoxide. We've got the herbal rainforest with its minerals and its echinacea. These are all must for dealing with respiratory problems. If you want to learn more about these products, then maybe go back to the web channel and listen to some of my previous recordings. Then we have the Beta 500. So Beta 500 it's a product that switches on the immune system. So it's naturally found in our foods. It's found in the cell wall of bacteria, fungi, and we're talking good bacteria. Remember, bacteria are our friend and foe. Now, since we don't produce it naturally, we have to obtain it from a outside source. We would normally get it through our food. We would normally have food that was not so sterilized in our younger days and our older, back in our grandparents' days, which is, of course, why we need the B12 injections, because we don't have enough dirt in our food. Believe it or not, we're too sterile. Well, here's the same problem. Because we're too sterile, our beta-glucan drops and our immune system drops. Okay, so we need to look at finding an alternative source. There's been so much information and research on this beta 500. The same with the selenium. It's one of the few nutrients in America that it is clinically proven to work with cancer, just like our selenium is. Okay, so there's been a lot of work on it, half a century, they say, in research. That's how far back it goes. And so it helps destroy cells, and it helps switch stuff off and on. Again, on my WebTube channel, there's a really good cartoon on how it all works. It's quite a good cartoon. Fructoid Z. Now, Fructoid Z is a great product. A lot of research again done on this. Anti-inflammatory, so it's going to help reduce any inflammation. It comes from sea vegetables. It's organic, certified. A university in Australia, the Tasmania University, I think it was, had done a massive study on fructoidein and its uses, and had shown also that it was very effective in cancer and inflammation, arthritis. And so it's a very great product, and we're lucky to have a product like that in our arsenal. And of course, we've been lucky to have good, high quality products as well. And as I said, there's over 800 studies. I actually think that when I first put this together, there's a lot more today. And of course, it's organic and kosher, and it's certified. It's a great one to not. There's certain things you need to have in your arsenal of supplements, and this is definitely one of them. And something I haven't spoke about much in the past is the goji. It's one of my favorite. It's one of my blends. Every day I blend a Beyond Tangy Tangerine, the kiwi minerals, and a goji. That is my flavor, my blend. And the goji, I sat in on a conference in America a couple of years ago on the goji, and the information they served up there was unbelievable. The millions and millions of dollars of research being done in the discovery of what goji does. It's been around for a very long time. It's considered one of those superfoods. It has a unique secret. It has a group of bioactive molecules called Lycium barbarium polysaccharides. They're not found in any other plants. This is specific to this one particular plant only. Extremely high levels of antioxidants, high in vitamin C, and it's a yummy flavor. No sugars added, no artificial colors, sweeteners, or anything. And as I said, it has a mate called Jewel of the Orient. So this also has the goji berry in it as well. So the Jewel of the Orient is a tonic based on the goji. And so one of the things I found with this particular product, with the research they've done, has this unique adaptogen action. Now, an adaptogen means come to balance, okay, or come right. And so in the human body, when we use an adaptogen, it's about bringing the balance back to the body, bringing it back right. And so this helps bring balance. So it's enhanced with health-promoting super nutrients from around the world. So it's not just got the goji, it's got various other fruits and vegetables in it, and a very good product. So that brings me to the end of my talk today on the respiratory stuff. Hopefully that's enlightened you with some new products to use for helping keep the system strong, dealing with any problems with that respiratory system. So now we're going to move on to our aromatherapy talk. And so we're going to introduce the Youngevity Downunder Aromatherapy Girls. And so we have Sally Muir, Karen Schurman, and Sam Kirkwood-Vales. These are our YGY Downunder girls. They have become very good and very adept at how the Youngevity oils work. And so this particular month, we're talking about cleansing, and April is about grapefruit, patchouli, meditative, and empathetic. Empathetic. You know, the girls are going to talk to you about that. That's not me. This is just my introduction. I would just like to hand you over to my lovely Sally, who will kick us off with all of this.
All right, so tonight we've got 4 oils tonight, as you've already seen, and I'd like to say that all of these oils are also great for the urinary system by chance. So if you have any problems with fluid or urinary tract infections, then these are the ones to go for. They're also excellent for the frail, elderly and babies, and are safe to be used around dogs. They do, however, need to be used with caution around cats, as cats' livers, they process essential oils differently. So they don't tend to process them as fast as humans, so they build up and are toxic. That being said, they're still safe to be diffused around cats, just not when they're trapped in the same room with you. As long as they can leave, then it's fine. So anyway, my first oil that I'd like to talk about tonight is patchouli. Patchouli has a varied range of uses. A favourite choice is an aphrodisiac, yet it is also used for fungal infections, skin issues, weight control, some types of acne, and tissue regeneration. Patchouli is effective against poisonous plants, relief from bee stings and insect bites, and as an anti-parasite treatment against certain classes of parasites. Tried and true uses have been, you can add it to a mister, and it eases cracked and chapped skin, dermatitis, acne, eczema, the weeping type, and allergic and inflamed skin. You can use it in a foot bath for fungal infections such as athlete's foot, and in a mister for skin candida. It's great as an addition in skin formulas, especially to help with wrinkles and cellulite. It's used often as an insect repellent, especially for moths. I didn't know that one. Historically used as an anti-poison oil for snake bites, insect stings, and poison ivy, and poison oak. Stinging nettle would probably be one you could add that to as well. You can add it to shampoo. It helps with dry, flaky scalps, and it helps relieve constipation. It also can help to reduce your appetite and water retention. So you could use it in the bath, or in your diffuser, or you can pop a couple of drops onto a cotton ball and sniff and inhale as needed. They're just some of the ways. What else? Blends well with neroli, frankincense, lavender, bergamot, ginger, and sandalwood. The properties, it's an antidepressant, so it alleviates depression. It's antiseptic, it assists in fighting germs and infections. It's an aphrodisiac. It also is great as a deodorant. It's sedative, so it helps to tranquilize the activity of certain body parts. And it's a tonic that strengthens and fortifies. So those are some of the things it does. Hopefully you'll give it a go. Okay, so next I will put you on to Karen. Thank you.
Hi everyone. I'm going to be talking to you today about pink grapefruit. After learning about this, it's actually quite an amazing oil actually. It's become one of my favourite oils. It's a cold pressed oil like all citrus oils, so the oil actually comes from the pore and the peel of the grapefruit. So, and it's very, very rich in EFAs, vitamin C and vitamin E. Now, this oil is cleansing, it's energizing, it's engaging, it's brightness, and it's relieving. And it's also a decongestive to the muscular and respiratory system. So respiratory, this one ties in with Kevin's talk. So it's going to help with those respiratory problems as well. And it is antibacterial, antiviral, antiseptic, and it's also an air purifier. Okay, so you can use it to diffuse or even use it as a spray and wipe, but Sally's going to talk about that later. So grapefruit is often used for kidney-related needs, as well as a stimulant to the digestive and lymphatic systems. and also other various internal organs. But on saying that, if you or anyone you know has had kidney or any organ transplant, then you shouldn't use it at all. Okay, you have to have your own kidneys and organs in there to be able to use it. And because it is good for the kidneys, it can lower your blood pressure too. Okay, because it's helping to support the kidney, it will bring your blood pressure down at the same time. And this is especially for blue-eyed people too, because according to Leanne, because she's very up with iridology, she does iridology as well with the oils, and blue-eyed people, generally, not everyone, there's an exception to every rule, blue-eyed people are susceptible to high blood pressure. So by helping the kidneys to function, it can lower the blood pressure. And I mean, I've had my eyes done by Leanne, because it's also good for the lymphatic system, as I mentioned before. And when she did my eyes last year at the conference, she picked up that I had a sluggish lymphatic, so I had to dry brush with bay laurel. So that's, you know, really helpful to know. So it's also a stress relieving oil, because it lowers your cortisol levels. Okay, and it's also beneficial to the skin, and because especially if you've got oily skin, it can balance your skin, so you can actually use it as a toner, and also if you have acne issues as well, and because it's antibacterial. So if you add it to plant-derived minerals and water, you've got your own homemade toner. And if anything like Youngevity, I don't think they sell the toner in our office in America and in New Zealand, do they? I think so. You can actually make your own toner by using the grapefruit oil. And if you are using it on your skin, there is a safety note. Because it's citrus, it is phototoxic. So if you're putting it on your skin, you're not allowed to go outside for 12 hours. So you either want to use it to balance your skin at night, or use it on a day maybe that you're not going out. But then again, if you're putting it on your skin and going out, it's not like you're going to be lying in the sun. So just don't go lying in the sun with it. You can go out with it as long as you're not putting your face immediately for hours on end under the sun. Okay, so that's that, but I'm just going to go through a few things that you can use the oil for. As I said before, you can use it as spray white, but Sally's going to talk about that. And also, if you have any type of smoke in your house, it'll get rid of smoke odours. And you can do that by using your diffuser. I'm always using my diffuser. Very good. And also, this is one oil that you can put in your tea. Most of the citruses, I think you can. Put 1 drop in your tea. It's great for your digestion. Never take it straight. Always got to be with something. And when you do put it in, you have it with tea, put some honey with it, because the honey will wrap around the oil. Okay. And here's something for some of us ladies, maybe not Sally, but Leanne said that, now I need to get this right, if you mix pink grapefruit with cypress oil and rub it onto the fatty areas, it will get rid of fat. But if you're anything like me, you probably need to go through a lot of bottles. But if you keep doing it every day, your fat will disappear, apparently. So that's worth noting. So that's with cypress oil. And you'd also want to put it with a carrier oil as well. It's good for your skin. And just keep rubbing that every day, morning, noon, and night. And what else can you use it for? You can use it, like, for example, if you've got any kidney problems or any other organ problems, you can use it as a massage with one of your massaging oils and just gently rub it around that area of where that organ is, and it should relieve and cleanse your organs. Does that make sense? And the last one is you can put it, if you do have any, want to sort of cleanse your body, or you do have any kidney or liver issues or anything like that, and for you want to look after your lymphatic system, maybe my favorite is to put it under my feet, top of your toe, under the arch of your foot, and maybe do that before you go to bed at night. So that is me with pink grapefruit. So I am now going to pass you on to my lovely aroma friend, Sam.
Thank you, Karen. I've got the empathetic blend. Got the card. And this is really great because Leanne produces this. It sets us apart from all other companies because it's about information and safe information. Leanne produced this oil. She formulated it so that it smells amazing and it's for medicinal purposes. Diluted properly, you can use it on your dog, kids, and the frail and elderly. For a dog, if you were using it, you'd use for on a dog that's 10 to 25 pounds or 4 to 5 to 11 kilos. For children from 3 to 5 and for the elderly, and it's really good as Sally brought out for the urinary tract. Now, if you're using this in the diffuser, the card says that you would use 10 to 12 drops in your diffuser every 2 hours. You'd have it on, and it says 10 to 12 drops for 15 minutes every 2 hours because it's really strong. Okay. She also talks about if you find a recipe online, remember our oils are really strong, so you've got to divide it by 4 at least. Now, when you're looking at this particular oil, what's in it in the empathetic is lime, spearmint, and lavender millet. Oh, there's a cat. Okay, and so in the spearmint, in the empathetic blend, it's great mixed with CM cream for rheumatoid arthritis. So if you suffer from arthritis, it's really good to mix this in the CM cream, the empathetic blend, because it's got spearmint in it. It's a very simple blend. It's amazing because it's got lavender millet, the lime, and the spearmint. I'll look at the lime from Leanne's book. Now, remember, it's online free, so you can go to leanneking.com and download it for free, still free. And in her book, she says that the properties for lime are it's antibacterial, antidepressant, anti-infective, astringent, antioxidant, antiviral. So that helps with inhibiting or destroying viruses. So that's really good around this time with the coronavirus. It's great for your digestive and lymphatic system. It's a great expectorant, a tonic for the nervous system, a toner, as brought out by Karen, great for toning and nourishing and supporting and strengthening the skin. Now, what else did she have to say? She talked about when you're using it for the frail and elderly, you would use 0.5%. So what does that mean? It means that you could make a lymphatic massage oil in this size, which is a 2-ounce bottle. So you'd have your oil, and then you put 4 drops in, and 4 to 8 drops. Give it a bit of a mix. Fill up with the rest of your oil to the top. Put your lid on. Give it a mix, and you'd use that for the skin. It's really good because the spearmint's going to be great if you've got arthritis. It's great for the skin. If you're going to use a diffuser, you can with 10 to 12 drops, and you can use it in your diffuser. 1 ounce water with 2 to 4 drops, running it for 15 minutes. That's under 1 ounce. Now, I'm just going to put a big plug in for Leanne's school. It's still on special at $277 US. It will teach you women's health, men's health, children. about pregnancy and fertility, gardening, house cleaning, pets, cooking. It covers all the body system, and these are all integrated with a study system that she puts out. Every month she puts out 4 to 5 oils, and she tries to coincide this with the Aroma Share Club, but it doesn't always work out. But if you go on the Aroma Share, you'll eventually get all the oils that you need to use in her school. You'll get, it's a fabulous tool. You'll become a certified aromatherapist. You'll be NAHA approved. And it's 90% off because it's usually $2,700 for the school. So it's only at $277 US, as I mentioned, 90% off. So you just go to leanneking.com and you can sign up there. Now, she did say she'll never turn anyone away if they can't come up with the dollars, and she'll just take whatever payment you give, and yes. So I think that's really great. Anyway, that's me, and I'm so sorry, Sally. I'll pass over to you for meditative.
Thanks, Sam. So surprise, I got meditative, which is really cool. All these blends, I have to say, they smell amazing. And Sam is so right. The plug that she did for this aromatherapist course is an amazing special. So if you have any sort of interest, she's done it because she feels it's a calling for people to be enabled to help themselves heal. So she's really trying to help the world out effectively. And I think power to her for doing that. Anyway, back to meditative. So meditative, unfortunately for me, has a lot more oils. It has cypress, frankincense, geranium, white grapefruit, juniper berry, lavender malleate, lemon, nutmeg, patchouli, western red cedar leaf, and ylang-ylang. And this oil smells amazing. It will help to relax you. So it's great also to help you to slip off to sleep. What else I can't really tell you a lot because I haven't looked into it. Other than it is worth a go. I know I love doing it in my diffuser. The other thing I can tell you is you want 10 to 12 drops in your diffuser, 15 minutes every 2 hours. Or you can put 12 drops of essential oil into 6. So 1 ounce is 30 mils. So 2 ounces is 60 mils. So 12 drops into 60 mils of plant-derived minerals, and you can spray that around. Or you can put it in the shower, 2 to 4 drops in some bath salts that are plugged over the plug, and then you put your drops in, and it makes for an amazing shower. So there's some ideas. The other thing I'd like to say is Karen is putting up the Aroma Share. So these are the recipes that we get. Can we see? Kind of. So Karen's going to pop that up in our WhatsApp 90 for Life group, so you can make some of these. The other thing that Leanne said, which I thought was interesting, and that if and when you do get any of our oils, don't go looking at other recipes off Pinterest or online, because you'll find our oils are stronger, and so you don't want to be going and using 20 drops when really, in fact, you probably only need about 10 or even 6. So just keep that in mind to stick to the recipes and blends that she gives us. Like, she gives us part of the school. You can get our foundational aromatherapy book. She gives that to us for free. You can download it and you use it through the school. So that looks like this, and it's huge. But anyway, in the back of this, she gives you blends and how to mix them and how to break them down so that they're not too strong. Hopefully that makes sense. Anyway, I hope you've enjoyed our talk for tonight. That's the Aroma Share Girls over and out. Thank you.
Oh, that's excellent. Much appreciated. Thank you so much for Sally and Karen and Sam. Okay, that's a wrap then. Thank you so much for coming on. We'll catch you at the same time next month. Everybody take care. Take it easy. Okay.
Bye, everybody.
Bye.
Bye, Auntie Mary.
Bye, Mary.
Bye, Ines.
Bye.
Bye, everybody. Bye, Lance.
Bye,
Bye.
Jackie.
Thank you.